this video, I'm going to be showing you how to break down a dental treatment room. Proper disinfection is essential not only for patient safety, but also for the safety of our dental staff. Let's walk through the steps. We need to have our PPE. OSHA recommends utility gloves. These provide better protection during the cleaning and disinfecting process. When we break down a room in between patients, we need to run the suction lines for at least 30 seconds. First, we take the saliva ejector and run it for 30 seconds. Then we take the HVE line and run it for 30 seconds as well. Once that's done, we will be doing this in a loop. We will use the headrest cover as our trash bag. Start around the tray. Remove all disposable items, bib, anything that would go in the regular waste. Nothing that's a biohazard waste, such as extracted tooth, gauze damp with blood, sharps. Any other waste would be collected at this time. Then we're going to start removing all the barrier covers. This we should do in a loop. That way we don't forget any barriers behind. Again, we have to work in an efficient manner. Remove the hand pieces. And continue your way, working in a loop. As per OSHA, you're not supposed to be touching underneath the barrier cover with your gloves. Sometimes this is impossible to avoid, so what we need to do is pre-clean and disinfect all surfaces. We continue to work in a loop, so we know that the last place that we have a barrier is on the assistant chair. After we're done collecting all disposable items, we discard it in the regular waste. Now we need to disinfect all surfaces. You could use a disinfectant wipe, but in this video we're going to be using a disinfectant spray. So spray thoroughly on a paper towel, or you can use gauze. And then you're going to thoroughly clean all surfaces. Pay special attention to high-touch areas like the dental chair. OSHA and the CDC recommend to spray the disinfectant onto a paper towel rather than directly onto surfaces. Direct spraying can lead to excess liquid penetrating into electrical components and sensitive areas, potentially causing corrosion or malfunction of the dental equipment. Keep cleaning in a loop. Go to the return tray and clean all the items there. For now, because we are still in the room and we are not going to sterilization, we're going to keep the tray there. So we're just cleaning underneath to put it again on the return tray until we are done with the rest of the surfaces. We're going to remove all of the hoses and clean them, and also clean the cradle. It is very important to clean the cradles because when we are using the hand pieces or the air water syringe, we infect it with bioburden, and then we insert it into these cradles and they get dirty. Again, everything that we do has to be in a loop so we don't miss anything. So now we go to the other side. And again, we clean the hoses with the cradle. This, in some offices and some chairs, the saliva ejector has that area that is removable. So make sure that when you are cleaning it, you don't take it off and throw it out. Always keep that in mind. In this chair, it is not removable, so you will not have an issue throwing that area out. Then we finish with the assistant chair. And because we did it in a loop, we know that we did not miss any surface. So that was the pre-clean. Now we're going to disinfect. You need to allow the disinfectant to remain on the surfaces for the recommended contact time. Always remember that something cannot be disinfected if it's not clean. So again, you're going to go through all the areas and always working in a loop. This way, you're going to be working efficiently. Once we're done with disinfecting the room, we're going to get the tray, clean the return tray underneath, and take the tray to sterilization room.